Hi, this video session is going to be on the management of mutilating upper extremity injuries. Now, plastic surgeons will be called upon to treat hand injuries, and the ultimate challenge will be not this is going to be a simple replantation, but this sort of injuries, which is going to be a mutilating hand injury. A mutilating hand injury has complex tissue loss and severe functional compromise, and often one that requires bone, soft tissue and microneurovascular reconstruction. Without surgical reconstruction, a mutilating injury will result in a mutilated hand, which will remain functionless, painful, and the patient psychologically stressed like this. So the principles and management of mutilating hand injuries are very important. Patient survival is the first priority. Next comes limb survival, then limb function, and finally rehabilitation. Patient survival, as I told you, is the most important, and the basic ATLS, that is the Advanced Trauma Life Support, must be carried out, which consists, as you know, of a primary survey and the usual A, B, C, D and E. These must be followed. Usually the patient may present with a very bad injury and a mutilating hand injury that may be more attractive to look at, and you may want to treat that first, but that is not important. The patient's life is important. The next is the secondary survey, where you look for any other major life-threatening injury in the rest of the body. The goal of reconstruction in a mutilating hand injury is to provide a hand with 3 fingers of normal length. 2 fingers is not enough. 3 fingers of normal length, and with near normal PIP joint motion, good sensibility, plus a functioning thumb. So the hand should be acceptable both from an aesthetic and functional point of view. So the aims of management should be not only restoration of form, that is, it should not only look like a hand but should also function like a hand. Now look at this hand. It has been reconstructed. It is a mutilating hand injury reconstructed, and look at the function now. It is a right hand. He is able to use the hand. Though not aesthetically pleasing, this hand is a functional hand now, and that is very important. So managing mutilating hand injuries, we will see the roadmap, what to do in what steps. Complete debridement is the first step, then restoration of blood flow, skeletal stabilization, muscles, arteries, veins, nerves, and finally soft tissue coverage. Now the classification of mutilating hand injuries has been many. There have been many classifications. The most important are the Wakefield and Reed classification, the Way classification, the Delitala classification of the metacarpal hand, and the tic-tac-toe classification by Weinsweg and Weinsweg. Now this is usually used where the area of injury, the structures that are involved, everything is shown in this tic-tac-toe classification. Now, the first thing that we have talked about, we need to talk about after ensuring that the life of the patient is safe, we need to talk about whether we can salvage it or whether we need to do an amputation. This is a very important question. Now, when you are in a consultation and the patient presents to you, it is very important to take this path-breaking decision. So the criteria for considering amputation, you must have at least 3 of these criteria. Open fractures with large soft tissue defect is one of the criteria. Warm ischemia time more than 6 hours with muscle involvement. Proximal major nerve injury, brachial plexus involvement. Now remember, these are not single criteria. We need to have at least 3 criteria which may be present to warrant an amputation. Then unstable patient, elderly patients, and associated major organ trauma and comorbid medical conditions which may preclude the prolonged anesthesia, and so when the prolonged surgery is being done, the life of the patient may be at stake. So these are indications for amputation. In the lower extremity, a mangled extremity severity score, that is the MESS score of 7 or more, is an indication to perform an amputation. But unfortunately, in the upper limb, there are no such parameters, no such objective guidelines to plan an amputation, but the guidelines that I had given earlier, that is the criteria, that is the 3 criteria must be present to warrant an amputation. However, each criteria depends on the situation and the condition of the patient. Now the next part is how to preserve the amputated part. When a part of the hand or any part of the body for that matter is amputated, it is important to preserve that part in the correct way so that it may be fit for a replantation. Replantation is the procedure by which a totally amputated part of the body is put back, and when it is being put back, there are different steps to be followed. That is, the fixation, the basic stability must be achieved, the arteries and veins must be anastomosed, and if there are muscles and tendons, they should also be repaired, and of course the skin closure is very important. So how do we preserve the amputated part? First, the amputated part needs to be washed well with running water, which is what will be available at the place where the amputation has occurred. Next, this amputated part which has been washed should be cleaned and put in a plastic bag. Third step is this plastic bag should be sealed. There should be no more contact of water with the amputated part within the bag. And this sealed bag must be put in a box of ice or whatever is being used to transport the amputated part. Once it is done like this, the part may be fit for a replantation depending on the condition in which the amputation has occurred. It is important to assess the vascularity when there is an injury. When there is an injury, first we look at the color. The color must be pink, and this will indicate a good vascularity. Then the warmth can be palpated. If it is warm, it definitely indicates that it is viable. But if it is not warm, it means it is a questionable vascularity which must be further investigated or further examined. Like for instance, you can make a needle prick with a needle, with an hypodermic needle, to look for the bleeding that occurs. If the bleeding is slow and sustained and is bright red in color, it means that the vascularity is good. But if the bleeding is very fast or it is dark colored, then it means that there is a venous problem. If there is no bleeding at all, in spite of the streak which is made on the tip of the finger, it means that there is an arterial problem. We also need to look for any vascular injury at the level of the wound.